what sorts of situations are you using ACTIVA? What types of clinical applications?
Well, almost in every posterior restoration, I'm using ACTIVA Restorative. I'm using to fill up endo access. I'm restoring MOD's restoration when the cusps are thick enough. If not, we go for indirect restorations. Also, I am using it to cement crowns, okay, or cement implant crowns, because I like to have rubberized behavior in the implant crowns, because we are transmitting less impact to the structure. So almost 95% of the procedures, restoring procedures, I'm using ACTIVA. Mm-hmm. Only for veneers, I'm staying with the Light Cream cement.